Welcome to MedMastery's Cardiology Digest, the weekly podcast where expert insights are unleashed. Stay up to date with the latest scientific findings in the field of cardiology and medicine. Don't forget to subscribe to our podcast to make sure you never miss an episode. We are Nora and Peter from MedMastery, and we'll guide you through today's episode. Enjoy!
Welcome also from me to today's episode, where we'll be covering the findings of 4 recent trials and editorials published in top journals. Let's dive into the first study titled Abbreviated or Standard Antiplatelet Therapy in High Bleeding Risk Patients. Final 15-month results of the MASTER-DAPT trial, published in the JACC Cardiovascular Interventions Journal in April 2023. The study compared antiplatelet therapy approaches for patients at high bleeding risk after percutaneous coronary intervention or PCI with a biodegradable polymer drug-eluting stent. The initial results at 12 months demonstrated that there was no difference in adverse cardiovascular events and less bleeding in patients receiving abbreviated dual antiplatelet therapy, meaning switching to single antiplatelet therapy after a month, than in those receiving a standard dual antiplatelet therapy regimen, meaning receiving at least 3 to 6 months of dual antiplatelet therapy. Investigators proceeded to report the final 15-month results, where routine care was allowed at the physician's discretion. At 15 months, almost all patients were on a single antiplatelet agent, while nearly 40% of patients were taking oral anticoagulants. The incidence of major adverse cardiovascular or cerebral events was similar in both groups, which was around 7%. The major bleeding incidence was lower in the abbreviated treatment arm compared to the standard arm, as was the occurrence of stroke. There were no differences in stent thrombosis or myocardial infarction rates. In summary, the use of abbreviated antiplatelet therapy in high-risk bleeding patients reduced bleeding without increasing major adverse ischemic events. Our expert commentees suggest that other studies have presented similar findings. Most interventionalists use dual antiplatelet therapy for 3 to 6 months after PCI, decreasing it to 1 month in patients at high bleeding risk, while continuing it longer in those with high ischemic risk, such as after MI. Furthermore, most interventionalists are leaning towards P2Y12 blockers over aspirin for antiplatelet monotherapy, and many ongoing studies are specifically addressing this choice. Nora, what's our next study in line?
Well, Peter, I want to share with you an interesting study titled Prevalence and Diagnostic Significance of De Novo 12-Lead ECG Changes After COVID-19 Infection in Elite Soccer Players. Published in the Heart Journal in March 2023, Bhatia and co-workers conducted research on electrocardiographic abnormalities in 511 elite soccer players who had been infected with COVID. The team recruited players from 36 clubs in the UK, Brazil, and the Netherlands with a mean age of 21 years, and 88% were male. With the median time to the post-infection electrocardiogram being 11 days, and players had received a pre-infection ECG, a median of 239 days earlier. During their research, the team identified de novo ECG changes in 17 corresponding to 3% of the athletes. These abnormalities were characterized by low amplitude T waves, flat T waves, or inverted T waves. Of those with de novo changes, 88% had inflammatory findings on cardiovascular magnetic resonance imaging. 71% of players with de novo ECG changes had cardiac symptoms versus 12% in players without ECG changes. Median COVID symptom duration was also longer in individuals with new ECG changes, with 5 days versus 2 days in individuals without ECG changes. On the flip side, none of the athletes with inflammation had abnormal stress tests or evidence of complex ventricular arrhythmias or myocardial ischemia. During a median of 479 days of follow-up, there were no adverse events in those with inflammation. So to summarize, the prevalence of post-infectious de novo ECG change was 3% in elite athletes, and most positive screens yielded inflammatory diagnoses but not clinical issues. According to experts, this study raises questions about the need to screen athletes without symptoms, since none of the athletes had functional limitations or adverse events. However, it also highlights that a post-infection ECG could be useful in detecting myocarditis in athletes, even those without symptoms. What's the topic of our next studies, Peter?
Well, Nora, there's some exciting stuff going on in AI. 2 studies, number 3 and 4, dive into the use of AI and ChatGPT in the medical field. Specifically, study number 3 is a Viewpoint article titled Benefits Limits and Risks of GPT-4 as an AI Chatbot for Medicine. Written by Lee and co-workers and published in the New England Journal of Medicine in March 2023. The researchers behind GPT-4 provide some fascinating examples of the AI's capabilities. In one instance, GPT-4 listens to a recording of a clinical encounter and then generates a clinical note in a format that is suitable for a patient's medical record. Impressive, right? The authors share a dialogue transcribed from an outpatient visit where a college student with an eating disorder and depression is resistant to her clinician's recommendations. GPT-4 generates a clinical note that captures not only the medical facts, but also some of the psychodynamics at play in the encounter. The AI even asks the clinician about the availability of some relevant information that isn't included in the recorded transcript of the encounter. The authors, who were involved in the creation of GPT-4, discuss that the routine use of large language models like GPT-4 could help to ease the burden of clinical documentation in electronic medical records. It could also shorten the often time-consuming and frustrating task of pre-visit chart review. But that's not all. A chat-based service could empower patients to query their records and receive understandable information and feedback. Think of it kind of like being able to talk to the electronic medical record like with an actual person, asking it about what it knows about the patient and potentially even making inferences about what's recorded in it. The same article also explores using GPT-4 for a curbside consult. A curbside consult is an informal consultation between two physicians regarding a patient whose care they are not directly involved in. The treating physician presents only basic details of the case, and the consultant offers their clinical opinion about the patient as a matter of professional courtesy. For example, a clinician asks, "What should I be looking for?" to determine whether a patient with chronic obstructive pulmonary disease is having an exacerbation. GPT-4 generates a concise 500-word discussion of diagnosis and management. While the value of the advice is somewhat uneven, exploring the value of longer conversations between clinicians and GPT-4 about complex patients warrants further investigation. Exciting times are ahead in the healthcare industry with the integration of AI and ChatGPT. Keep an eye out for further developments and improvements in the future. Paper number 4 is similar, right, Nora?
Yes, Peter. Paper number 4 is entitled AI-Generated Medical Advice, GPT and Beyond. Recently, a group of authors led by Haupt published an essay in JAMA. They discussed various legal and ethical issues surrounding the use of GPT in medicine, particularly in patient-clinician relationships. The authors distinguish between using GPT to augment or complement a clinician's judgment versus using it to completely replace it. They also express concern about direct-to-consumer use of GPT for medical advice. With the full electronic health record, EHR, all clinical notes, diagnostic tests, and procedures become accessible to AI tools. This means that model synthesizers can generate text that can be used to alter virtually any clinical encounter. However, it's important to note that we still have much to learn about the upsides and downsides of these technologies in the healthcare field. While AI in medicine has the potential to improve administrative tasks and help healthcare providers make difficult diagnoses, there are still many challenges to consider. Large language models don't naturally understand text. Instead, they synthesize intelligible-appearing text, which isn't always grounded in truth. This means that AI could potentially misrepresent clinical reality at any given time. Despite the potential challenges, we remain optimistic about the advantages of AI in medicine. With AI taking over more tedious tasks, healthcare providers could focus more on the patient's needs.
Thanks, Nora. Super interesting stuff. Definitely very exciting, but also something we need to examine critically. Let me ask you, our listener, something. Have you ever found yourself struggling with a patient's diagnosis or treatment plan, unsure of what to do next? As a clinician, it's important to feel confident and capable in every patient interaction. That's where Med Mastery comes in. We're here to help you become the best clinician you can possibly be. Our courses teach you the most important clinical skills so you can solve over 90% of patient problems without the help of a more senior colleague. And don't just take our word for it. We've won numerous teaching awards and are highly recommended by the British Medical Association. Plus, all of our courses are CME accredited, meaning you can earn continuing education credits while improving your skills. We've already taught hundreds of thousands of clinicians worldwide, and 21% of our subscribers report that we've even helped them save lives. Imagine the impact you could have on your patients with the knowledge and confidence gained from our courses. So what are you waiting for? Check out our award-winning courses and become a great clinician too. With MedMastery, you'll have the skills and knowledge to provide the best care and even save lives along the way. Go to medmastery.com and register for a free trial account, which will give you access to the first chapter of each course.
Thanks for tuning in to MedMastery's Cardiology Digest, your go-to resource for the latest scientific findings and expert insights in the world of cardiology and medicine. Join us again next week for more valuable updates, and don't forget to subscribe. Till next time.